Hey everyone, I'm Dr. Mayer with iPower Physical Therapy, and I'm here to talk to you today about back pain and some exercises that you could do to help out with that. So first of all, I just wanted to talk to you a little bit about back pain and how it can present itself. A lot of times, yes, it could be just the back and it could be one small part in the back or a wide area that takes up the whole lower part of the back. One of the other symptoms that can originate with back pain is getting pain that goes down into your legs. That includes even going from the back into the buttocks and then down to the back of the legs. Sometimes people will have pain that includes just hip pain or knee pain, or I've even treated plantar fasciitis with back exercises. So if you have any of those symptoms and you've tried different things to help out and it has not helped, it could be coming from your back, so this would be a great exercise for you to try. Now, one of the things with back stretches is a lot of times people will consider just doing an exercise, pulling those knees up to your chest or stretching out the hamstrings, doing something like that. Which that's all good. Don't stop doing those things if they seem to be helping. However, one stretch that people tend to not even think about is stretching backwards. And that's because of a couple of things that it can do for your back. If you're always bending forward, you're putting a lot of flexion onto your spine, and that's going to influence how your discs are being, the kind of pressure that's being put on those discs. And that can in turn cause some of the pain that you're having in your back or down into your legs. So one of the stretches that I'm going to show you is to extend backwards and stretch backwards. That will put a different sort of pressure on those discs. It might be a little uncomfortable at first, but stretching always is. But once you get used to it, it has been found to be tremendously helpful for a lot of people and can help to relieve a lot of their symptoms. So for this first exercise, what I'm going to have you do is you're going to lay down on your stomach, and then I just want you to lay there, get comfortable like that. Especially if you have not laid on your stomach for very much or very long at all, this might just be a stretch in it of itself. You just want to lay there for a couple minutes, let your back relax, and then just get comfortable. Once that's better, then I want you to come up onto your elbows. You're going to lay there on your elbows for a little bit, again, letting that back stretch and relax. If you have shoulder problems, this might be as far as you can go, and that's fine. You don't need to give yourself other problems or other pain just to try and help your back, because I know a lot of people that have multiple issues going on and it's not just their back. So if you have any shoulder problems, elbows, wrists, this might be as far as you go. And you can just lay there for 2 or 3 minutes and then lay back down flat, come back up onto those elbows for 2 or 3 more minutes. If you don't have any problems, what I want you to do next is you're going to do a push-up. When you do this push-up, I want you to keep your hips and your legs flat on the table so that when you come up and you push, you're really arching backwards as much as you can. You're going to feel a real good stretch back there, but try to relax as much as you can. And then I want you to do about 5-10 repetitions of that, and then see how your back feels or see how your symptoms feel. If you have pain in your foot, get up, test that out, and see how that foot feels. If it's your knee, or if you have symptoms going down the back of your leg, or if it's just the back pain, test it out and see how it feels. In one of the previous videos, I talked to y'all about the importance of getting some extension in your back and stretching the opposite way instead of always bending forward to help counteract some of that flexion that we always have in our spine. But sometimes what we do in therapy is I try to find what we call a directional preference. And that means when you're having back pain, what direction does your spine want to stretch in to help relieve some of your pain? And most of the time that is stretching into extension. However, sometimes there is a time when you need to stretch into some flexion. And so this next exercise is what we call double knees to chest. You're just pulling your knees up to your chest, stretching out your back. That's one of the most common exercises that people will think of when to stretch out their back. So what you're going to do is lay flat on your back, pull your knees up to your chest as far as you can, and don't just pull them up, easily. I really want you to stretch and try to get those knees all the way to the chest as close as you can, trying to stretch out that low back. And now I want you to do that about 5 to 10 times. And every time you do that, you just want to relax into that stretch. You don't need to push it. It doesn't need to be painful, but you want to stretch that as much as you can for that to be comfortable and relieve some of your pain. So again, if you're having any sort of pain or symptoms, pain in your back, symptoms going down into the leg or into the foot, anything like that, once you get done stretching, then I want you to get up, test that out to see if there has been any sort of change in your pain, whether that pain is a smaller area or that pain is a little bit less intense or it's in a more centralized location. You'll always want to test out to see how your pain feels after you get done. So the next exercise that I wanted to talk to you about is more of a strengthening exercise, and it's called bridges. And what this exercise does is focus on improving the strength through your glute muscles. Now these muscles are important because if you look at this picture right here, these muscles are big muscles right back in our buttocks and our rear end, but they're big muscles for a reason. They give us a lot of support, and we tend to neglect those muscles and not use them when they give our back a lot of support. So it's very important to get these muscles nice and strong and to give us a lot of support. Now with this exercise, another muscle that we're going to be engaging is called the latissimus dorsi, and it's a big back muscle. And again, that will help to give our back a lot of support. And it comes all the way from up here and attaches onto our arm and comes all the way down to those glute muscles right in there. So again, these are big back muscles, and they are very important for whenever we're having any sort of back pain, to help relieve that pain, because we need our muscles to be nice and strong around our back in order to help give us any sort of relief from pain. So what I want you to do is you're going to lay down on your back, and I want your knees bent with your feet flat on the table. And then from that position there, also I want your hands down flat on the table right next to you. And then from that position there, what I want you to do, you're going to push down, lift your hips up while pushing your hands into the table at the same time. As you lift your hips up, that will engage those glute muscles. And then as you push your hands down into the table, that will engage that latissimus dorsi muscle that I talked about. And then you're going to go back down to the starting position. I want you to perform this exercise 10 times. This will start to get your glute muscles and your back muscles a little bit stronger to help give your back more support to help relieve some of your pain. If you have any questions, comments, or concerns, please feel free to drop some comments below.